finger, you pay attention on the color, on the stool, on the. Okay. Any questions on this?
No.
Practical skill? No. Next one. Method of stomach examination.
Are we
How
gonna
to
do
examine
it?
the stomach?
We'll
Visually
just
first.
show how to do it.
By allowing the patient to lie supine. Okay, the patient should lie supine on the bed or table, whatever, and then you take the patient's clothes above and beginning with superficial palpation, you palpate from the tecum parts around as concentric manner to the umbilical part to the center, and then you begin with a deep palpation the same manner around. And when you're doing that, you try to observe, look at the patient's face and see if the patient feels any tenderness during the palpation, or you also try to observe if there's any pain, mass or any distension or anything when you were palpating. And then after that, you can then palpate the organs, palpating the ascending colon.
Okay.
Palpating
You do understand that the physical examination gives us a lot of information about the state of the stomach. But what instrumental methods may be used additionally?
gastroscopy.
No, you can use
What is this?
endoscopy.
This is not. This is connected.
Instrumental methods, you can use ultrasound.
It's very important to first ask the patient where the pain is, so you can start away from the pain. You shouldn't start anywhere.
First of all, the nasogastric tube. What information may we receive from inserting this tube?
You can see what is
The contents.
content, the fluids.
You can use it to aspirate. Yeah. My phone is always really sticky. No, but my phone can take a full
For
movie.
example, this one.
Yeah.
How to first of all, practical question. How to introduce this tube? Bara, show us.
Through the nose.
She is model. Show us. Metal.
Hey, lovely, your head.
How to introduce this tube? What should we do?
First, you should lubricate your tube.
You ask the patient to tilt the head a little bit downwards. As in
May you show?
video.
Okay, let me take a
Hi. Yeah, I think you have to measure it. First of all, you have to measure the distance from, as in, you have to, from the nose down to,
Distance from here to here, and
yeah,
you measure
you
this
measure from
distance.
here to here, and then, like, and then to,
Down to the
then to the, yeah, then to the navel,
I'm going to post
and
it on
then,
YouTube.
Not now.
Xiphoid process.
oh yeah, the xiphoid process.
Little bit lower than xiphoid process.
That's like in between the xiphoid and the navel.
What does this distance tell us?
The distance from the stomach, like to the bottom of the stomach, like the lesser
This is the
curvature.
smallest distance on which you should introduce the tube. You try to get to this mark or maybe a little bit further. You may mark this just on the tube.
Yeah.
Then what should we do?
Then you ask the patient to tilt the head a little bit like upwards, and then you start the introduction of the distance, the tube.
How?
Like slowly and gently introduce it, and
Where?
then through the nose, through the nostrils.
Okay.
And then if the patient has like any pain or anything, you stop for a while and then you continue introducing it till you reach your mark and then you stop.
No.
You should tell the
You
patient
can't
to
introduce the tube inside.
You should tell the
Then you have
patient
to
to
swallow.
When
What if
you
the
reach
patient
this
cannot
place, and when you reach the measurement to this place, then you can ask the patient to try to swallow the tube as you gently introduce the tube into.
First of all, what should you do? It's interesting to do with this thing. You have to check the possibility of the nostrils. Breathe, please. You see? Just close and check whether it's possible.
To breathe.
He can't breathe, and possibly we can introduce the tube. Ask the patient, maybe he has some problems with the nose and the,
Trauma.
maybe in trauma, congenital problems, polyps and so on, you can't pass the tube through it. Ask the patient about this. Then you have to introduce gently through the lower
Nurseries.
nostril pass, maybe lower nostril canal to the throat and gently move it down. But when he will feel the tube in the throat, he began to cough and ask the patient, give you the signal that you approach this place. And you'll see this from his coughing and vomiting. This time you have to, this moment you have to stop. And what should you do then?
Change the position of the patient
How?
by telling the patient to lie this way on the right
Oh.
side.
You may introduce, even start the procedure from with the patient on the right side. In sitting patient and the patient lying on his back. I prefer to put it on the bed and stay behind the head. It's save you from the coughing, from the everything that fly from his nose and mouth while you perform the procedure. And do from this side. If it's possible, move them and stay behind the head. Then, while you introducing through the nose, the position is not so important. You may raise his head, for example, he is lying, for example, raise, introduce. Oh, now we are in throat. Then we take the glass of water and ask him take some amount of water into the mouth, but not swallow. Then we ask the patient to put, or help him to put the head in such position. Why?
Not to go to press the pharyngeal part or something, the
prevent
posterior
choking.
part of the.
So the tongue doesn't go back.
To prevent choking.
In such way we open the esophagus
Oh.
and a little bit closing the larynx. Then we ask patient to swallow. Here we holding the tube. Ask patient he swallow, and this time we push the tube. If it went in the correct direction, 2 or 3 or 4 swallows and the tube will be in the stomach. If he begins to cough and experience hard the breathing, you should think that you are in trachea. Then, if we suppose we are in incorrect position, look where is our mark on the tube, and then what should we do? It's necessary to control. Maybe patient feels not adequately feels the tube. Maybe it's in trachea, and we don't know this. And he doesn't give us information that doesn't give us the signs of the presence of the tube in trachea. How to check the position of the tube?
You check the level, if it's up to your mark.
Aspirate.
Yes, it may stay up to the mark.
Aspirate.
First of all, we may see nothing from the tube. First, we may cough. It may go somewhere and we don't see nothing. If we see the content running away from the tube, and this is gastric content, you understand that you are in correct position. If not, you may try to aspirate a little bit by the syringe, or take in the syringe some amount of air, connect to the tube and push it. Putting the endoscope on the epigastrium. If you hear bubbling over here, you understand that you are in correct position in the stomach. Not liquid, by air. By air. If you are sure you are in correct position, you may continue. First of all, fix the tube to the head. How to do this?
Tape. Or
Like a bandage, like
tape.
It's a tape.
thread.
Tape can't
Really?
preserve it. position. It's necessary to take.
Room to tie
Around the ears.
and tie it around
You
the ears.
take the strip, some strip from gauze, maybe special strip. Put it around the head up to the ears. Then you should first of all, for
Make a loop.
example,
Make a loop.
take it. Take it. At the level of the nose, first of all, you tie the tube, and then somewhere here you may tie this strip. You see? And control the position is correct. You may put here some tape to see the place, first of all, to see the place where you fixed the tube. This is like a mark. And it prevents from the sliding. Okay, let's continue. Is it then, do you understand? This is tube. It's we receive a lot of information. What is this?
Endoscope.
You will perform what? Endoscopy. Another way of the examination of the stomach is X-ray.
X-ray.
Okay.